Namaste. I'm Dr. Vandana Gawdi. I'm an obstetrician gynecologist working in Apollo Hospital, Navi Mumbai. And today I'm going to talk to you about women's health. And it's a very, very large topic. And someone very nicely said once that good health is not just merely an absence of any disease. It's a complete sense of physical, mental and social well-being. So when we talk about a woman's health, we really mean that she should be physically, mentally and socially well, healthy and, happy in her current environment. Now, why are we talking about women's health? Because the reason being that there is something different about a woman as compared to a male's health, because the responsibility of childbirth is primarily with a woman. So she has some unique health issues which are different from a male. And also it is important for us to understand that, women, I personally feel that women are forming the central pillar of the house. So imagine there's a house and then there's a central pillar which is supporting the entire house. And if that central pillar is defective or it's weak and it falls, then the entire house can collapse. So in the same way, when a woman is looking after her health and not putting everybody else's health ahead of her own health, is when the whole house can remain healthy. So today, when we talk about health, we don't just talk about treatment of diseases. Again, when we want a person, a woman, the whole of womankind to be healthy, we would like to talk a lot about educating women. So it's very important that you visit your gynecologist. Have points of contact where, health education can be given. It could be in the school, it could be in your classes, it could be a doctor coming and talking, it could be a social worker, it could be your teachers. During the time when you've passed out from school, it's a good time to come and meet a doctor. So education about preventing disease is very important. And secondly, we are very, very passionate about screening. So screenings are simple methods in which you pick up diseases in the very early stages so that they don't transform into major health problems. Okay. Now, when I talk about a woman's health, I'm going to really divide a woman's life into three parts. The first part is before she's married and when she's an adolescent. The second is during the period when she's married and up to the time she attains menopause. And the last part will be after she attains menopause. And that's an equally important part because women are living longer. So post-menopause, we are hoping that she lives for a good 30-35 years. And that's a segment of women whose health is not very well, given any attention. So I'm going to talk a little bit about all the three phases. So we talk about the first phase in which the woman, she's a child basically. She's just hit puberty. Now this is a good time to start some health education. Explain to her, if you're a mom, just talk to your child through the net, maybe with diagrams from the net, or open up a science book and talk about what is the reproductive cycle. If you are not comfortable talking about this, bring her to your gynaec and talk a little bit about what is reproduction, what is the menstrual cycle, what are the safe hygienic methods of disposing menstrual blood using a menstrual cup, or maybe how to use a sanitary napkin hygienically. So we start initiating healthy thoughts in this girl. The second thing at this stage you would want to definitely talk to her about is inculcating a healthy lifestyle. When you're young, you're very bindas. You think your health can never go wrong. But good lifestyle choices and lifestyle habits are ingrained in a girl at this stage. And if it's not, it is going to lead to hormonal problems and later on a lot of problems associated with lifestyle, which is now becoming the major issue for all women. Okay, so this is a good time to make her do outdoor exercises, sleep on time, limit her screen time, eat healthy, don't eat too much fast food, junk foods, sugary stuff, try to avoid all of that. And the third thing that we would want to discuss at this stage is the vaccination, the HPV vaccination. HPV basically is the human papilloma virus, and this is a virus which causes cervical cancer. It is one of the leading causes of death due to cancers in the older age. And the appropriate and right time to vaccinate your girl child is somewhere between 9, 11, 15 years of age. So this is a time to think about that. One more thing, very important, and a lot of people are reluctant to talk about at this stage, especially when she's in her early teens or maybe mid-teens, is birth control. So, we may all pretend that this doesn't happen in India, but trust me, we are seeing a lot of unmarried girls coming for abortions. Now, we're not judging, but what we would like it open discussion about safe birth control methods so that no young girl has to undergo an unsafe abortion. So, this is a good time. Don't feel shy to talk to your daughter about this. If you are not comfortable, again, bring her to a gynaec and let's discuss this. Let's hope she doesn't need to use it. But if she does, she should be informed and she should know how she can prevent an unplanned pregnancy. Okay, then we come to when she's married. Now, when she's married, again, if she has missed ever having a discussion on birth control, this is a visit to a gynaec to discuss about the safe methods of birth control is very important. So this is a very important part of your health at this stage. You should have the choice of getting pregnant only when you want to have a child. That should be your aim. So every unplanned pregnancy can be avoided with a good contraceptive method. There are several, and on a one-to-one discussion, this can always be elaborated upon. Second is, now you reach a stage where you're planning a child. So again, it's a good time at that time to come to your doctor for a prenatal counseling and decide about lifestyle changes just before you plan your pregnancy. Also, a good diet, nutritional supplements, and all of these will help you to have a healthier pregnancy. Again, during pregnancy, it's important when you go to your gynaec to, take regular supplements, regular antenatal checks, identify pre-existing problems which you didn't know probably, like for example, a thalassemia minor. You're a thalassemia minor, you need to identify, you didn't know that you had high blood pressure. Unfortunately, now we are finding a lot of young girls with undiagnosed diabetes. So, you need to have that initial visit to diagnose any pre-existing problem and also identify any new high-risk problems which happen during pregnancy, so that you have a team approach and your pregnancy is taken care of safely. And the whole point is, and then you have a good experience of delivery, have a normal delivery, have a healthy mother, healthy child, and make sure that you're correcting your anemia, because anemia is very common in India and very many times it's just missed and discovered the first time that the girl is pregnant. The whole point is we want to bring down the maternal mortality. So the maternal mortality basically means how many women will die with pregnancy related complications in a year. And that would be really tragic if it's very high. And you'll be surprised to know that still we are much ahead of even underdeveloped countries like Bangladesh and Pakistan. So we have a lot of work to be done to create awareness of how to bring down maternal mortality. Also during pregnancy, I would like to discuss the benefits of breastfeeding, motivate every girl that be ready, that you need to make sure that you're exclusively able to breastfeed your child for 6 months. And post-delivery again, give support so that she's able to successfully breastfeed her child. And also post-delivery, I would like every woman to have access to advice about contraception again. Because a lot of women come back to us post-pregnancy when they don't realize that it's very easy to get pregnant again, and they come back very quickly because they're not ready for a second child so soon. So we would want to avoid that part of things which spoil your health, because abortions are not a joke. It may look simple, it may be very inexpensive, but it always plays on your health. So we would like every woman to try and avoid an abortion if she can avoid it. There are a lot of safe methods to avoid it. Then in this stage of your life, there are other problems apart from childbirth. So, your health issues could be hormonal problems, breast problems, fibroids, abnormal bleeding, ovarian cysts, even cancers. So, this part of your life, again, a healthy lifestyle. So, you've not had the advantage of meeting somebody before you got pregnant. Again, this is a good time to come to your gynaec, talk about all these things, get regular screening done. So, that comes to my most important message that I would like to give everybody is a regular pap smear for every woman who is sexually active is very important, because the pap smear is a simple way. It's still the gold standard for picking up early stages of cervical cancer, and nobody needs to die of cervical cancer if it's picked up early. Okay, so screening and regular health checks. Now, as you grow older, when you're in your early 40s, then your menstrual problems might increase, your hormonal problems might increase. So here, after the age of 40 again, breast cancer screening is very important. So it does not necessarily mean a mammogram every year, but you can come to your gynaec and learn about how to do a self-breast examination, which should be ideally done once a month for every woman at the same time of the period. So preferably we say just post-menstrually is a good time to do your self-breast examination. Go to your gynaec, learn how to do it and do it properly. Then the other thing is get regular ultrasounds done. Sometimes you have silent ovarian tumors, which today unfortunately many a times even in early 40s they turn out to be malignant, so screening needs to be done. in this stage of your life, there are very many women who come to us with infertility issues. This is the exact opposite of childbirth. So there is a lot of anxiety when you're trying to conceive, when you're unable to conceive. So, there's a lot of pressure on a woman, and this pressure is felt more than the male partner, because society tends to put the burden of childbirth and reproduction on the woman alone. So this is a time where she might need to come to a gynec and screen out whether there are any problems with her, identify if there are any problems, be reassured that there are no problems, how to take care of your lifestyle to enhance your chances of pregnancy, and then have the choices. Suppose there is a genuine issue, you have a lot of choices of methods of conceiving through a little bit of help. They're called ART methods, artificial reproductive techniques, not necessarily straight off to IVF and ICSI, but you have options of planning how to have intercourse at the right time, doing a little bit of self-monitoring, maybe a little bit of follicular monitoring, maybe using a few drugs here and there to help you to conceive faster. But you also have choices like, suppose it's an extreme case and you're unable to conceive with all of that, you have choice of an egg donation. You also have choice of preserving eggs. Now this is the thing that I would like to talk about, is preservation of egg is a very simple method, not expensive at all. So there would be two categories of women who would choose to do that. One would be, she's in her late 30s. She's reached 37, 38 years of age. She's still not found the right partner in life who she wants to have a child with. But she definitely wants to have a child somewhere in the future, and she's pretty confident she'll find somebody she wants to be the father of a child. So it's a good time if you reach that age and still you are not sure and your biological clock is so-called ticking away, get an egg preservation done. And the second type of women who would need an egg preservation would be someone in which some kind of treatment is required which would harm their ovaries, harm the egg production. So somebody who needs a chemotherapy or a radiotherapy, and she's still not had completed her family or not started her family, then egg preservation can be done. Today there is also a possibility of surrogacy in case of all kinds of extreme cases. We're not going to go into details, but it's a very viable possibility with a lot of legal limitations. But once you follow all the legal limitations, it's also a choice that you have. Okay, now we come to the stage where you have attained menopause. Now there are so many problems with women post-menopause. It could be just hormonal problems, but the most important at that time is your risks of cancers increase. Your breast cancer risk increases, your cervical cancer risk increases, your uterine cancer risk increases, your ovarian cancer risk increases. But apart from genital and reproductive system cancer, in general, as compared to other, similar to other males, your cancer of other, your colon cancer, your lung cancer risks also increase. So appropriate, screenings need to be done, not just with the gynec, but your gynec could be the point of contact to direct you to which side you need to go, and meet your colorectal person, meet the breast cancer persons. If you have a family history of breast cancer, you have a possibility of doing some genetic counseling, meet a counselor and know what is your risk, because some of the breast cancers are genetic in nature, okay? Now, the other thing which will also at this stage be important, a part of your, the type of problems that you could have is your bone density goes down. So women and men are different in this way also. So, men, their bone density is not dependent on any hormone. In women, the estrogen, the female hormone, protects her from any bone problems till the time that she has estrogen in her body. The moment the estrogen is cut in her body, it stops at around 50, 51. The bone completely goes for a toss. The density of the bone goes down completely. The bones may become hollow, they may become weak, and a lot of women in the older age, if they're not careful, they get very many fractures, especially of the spine, of the wrist, of the head of the neck of the femur, and these can incapacitate you and require you to go for surgery. So you need to, meet your gynec or an orthopedician and make sure that your bone density remains good. One of the best ways, without meeting any doctor, is just continue doing exercise. So whenever you do exercise, and the simplest exercise is walking, because as you grow older, you may have some knee joint problems, ankle problems, it's difficult to walk, backache hai. It's difficult to do other exercises, maybe go to the gym, Zumba, but walking is something that everybody can do. So just walking actually increases your bone density and makes your bones stronger. Then you have other lifestyle problems, which of course with any aged person, they become your renal problems, your blood pressure, your diabetes, your heart problems. all of these need to be screened regularly. So, after the age of 50, we definitely recommend that you do your annual health checks. We have very good annual health checks, good packages in Apollo, and you can come and, choose what suits your requirements. There are design packages for every different kinds of group of suspected problems. It's a good idea to start doing this regularly. And basically, the most important thing that a woman also needs to know is her mental well-being has to be taken care of at all stages of her life. And one thing which is very badly neglected is that once the woman's children have grown up, she's given her whole life to her family, and once the children have grown up, she has nothing much to do. She suddenly feels irrelevant in life, and that is a time where she might go into depression. Around the time of menopause, that's the time when hormones are also getting changed. So this is a time where you need to take care of yourself, find something to focus your mind on, and to find your purpose in life. The last thing is her sexual health. So women are very trained to think that their sexual needs are not important, and if she's finished childbearing, well, she really doesn't need to have sex anymore, which is a very wrong thing. I know of so many women who are in their late 60s and they have a very healthy sexual life with their partners. If you're in a committed, happy relationship, it's important to discuss this with your doctor, that as your sexual drive goes down, as the vaginal dryness increases, it becomes more difficult to have an intercourse. What are the things that you can do to maintain a healthy sexual relationship with your partner? So, in conclusion, I would like to say, like I said in the beginning, that though women's health problems are unique, they are the most neglected. And all women out there, I would like you to know that, there are enough, enough doctors who are willing to talk about this, start educating. If you have missed the education, make sure you make your daughter come and meet the right persons to understand that her health is always going to be as important as the male in the family. Thank you very much.